வணக்கம் சார்.
வணக்கம் டாக்டர்.
உங்களை சந்திச்சதில் நான் ரொம்ப மகிழ்ச்சி அடைகிறேன். I'm very glad that I met you today. Here with us viewers, Dr. Ernest from Oman. Sir is working in Oman as a senior dental surgeon with lot of experience in maxillofacial surgery team, and we are going to hear his experience in Muscat and in Oman country. Let's hear his story. Sir, where are you from? From India?
Yeah, I am from India and born and brought up in Chennai.
Excellent. Okay. Which college you are from?
So I am படிச்சது BDS doctor. I studied in Ambedkar Dental College in Bangalore, and it's in Coxtown, and I finished in 1998.
Excellent.
I think 92 batch actually.
Excellent.
I finished in 98.
Lot of young dentists, they want to go to Gulf countries because they feel the scope of BDS in India is poor. So I want to get some enlightenment about this. Is it true? How is the scope of dentistry in Oman especially? Because we have few doctors who have given about Qatar. Mm-hmm. So right now we are focusing on Oman. Let's hear it about Oman.
Yes sir. Those days, that is during my times, it was very lucrative because ministry jobs were available, and we had to go for a written examination, and then we had an interview. So that's how we were selected. So because I was selected in Ministry of Health, you have signed a contract where you can work anywhere in Oman. So I was posted in a place called Sanala. However, the scenario is very different. The reason being that the locals have come for the jobs now, and they have started their own dental college. So there are a lot of locals who have finished their BDS and they have come to work now. The point is, now the ministry jobs have all been Omanized, in the sense that all the locals have come for the ministry job. So right now the scope is only in the private sector, and which also the scenario could be changing. But then as of now the scope is in private sector. In the private sector you have to write an exam called Prometric. It's a Prometric exam. There is a website. You have to go to the website and apply for this Prometric exam. And after the Prometric exam, then you will be called for the interview. Once you are called for the interview, you have to go for the interview along with a recommendation letter from the local clinics. So once the local clinic says that we have a position for this doctor, then they will allow you to take the exam, and then they will give you a license. That's how it works. After the license, you can practice.
So, dear viewers, what sir is telling is there are two types of jobs we have got in Oman for dentists. One is the ministerial job, which is the government itself is employing the abroad dentist, immigrant dentist, and second is private practitioners who needs your help in their country. Okay, so there are two things. So now presently the country of Oman has got their own dentist, the native of Omanis we call. So they themselves want to get in the ministry. So the chances of you getting into the ministerial job is very less. As for 2022, this video is being taken in July. So this is ground reality. So if somebody is telling something, please don't believe it, because is it true? This is true even in Saudi also. So presently, sir is telling there is a vacancy we have in private clinics, and there are a lot of clinics are looking for doctors for implants and things like that. So what you have to do, sir was telling us, you have to clear the Prometric exam, right sir?
Yes.
So once Prometric is cleared, that exam, Prometric is conducted in India, right? Through online. So sir, exactly Prometric is an online document verification, right? Or data flow?
No, there is data flow is all this thing. That comes during the application process.
Okay.
Prometric is a written monthly MCQs.
So that it's Prometric what you are telling is particular for Oman or particular for all the
particular for Oman.
Oh, okay.
So the different countries have different types of this thing.
Okay.
But in Oman,
what is the syllabus for the Prometric exam?
Prometric, the syllabus is general dentistry. Basically, what I have seen is they follow a standard of Oxford. So you know these Oxford books for the dentistry.
Yes.
I think those books should be sufficient. Mm-hmm. Writing this thing.
Is it tough or is it easy?
It's not tough. But you have to upgrade yourself. To be very frank, if you are following the standard of UK books, those kind of books, that will help you.
So after Prometric, if they
because one of the reasons why I tell you this, see, we all calculate the blood sugar in what? We are all calculating, but they calculate in the moles.
Okay.
So you need these kind of variations,
Okay.
which we need to upgrade into the
Okay.
UK system. That's all.
Okay. My question is, after the Prometric is an online exam. We can write from India. So suppose when will be the result will be out?
Prometric is I think within a week or two. I think
Okay, within a week you get the result. Okay, I passed. Then what I have to do next?
After the Prometric, what you have to do is you have to get a attachment in a local clinic. One of the local clinics, the clinicians who are having an established clinic there, they have to give you a letter of undertaking saying that they have a space for you to work. So once they give you that space for you to work, then you can apply for the license. For the license, they will call you for an oral interview. That is the time you go for the oral interview, and once you clear the oral interview, they give you a license. Once you have the license, you can start practicing.
Now the candidate has cleared the Prometric, got a letter from the local clinic saying that is a vacancy, and the third thing is I got a license also. So please tell me this. What about BDS and MDS difference? What is the life of a BDS there in a private clinic? What is the income they get? What are the perks they get, like air ticket to come and go? And what is the difference between BDS and MDS pay scale? All these things I have to know.
In ministry, right now there is no scope, so let us not talk about that. Our times were different. But in private, it depends on where you get. What they do is, usually they offer you a job, and for a salary of 600 riyals. 600 riyals with the present exchange rate is translating up to 1 lakh to 20,000 rupees, Indian rupees. But this is basic pay. After this, what they do is, anything you make more than 1,000 riyals or 2,000 riyals, it depends on the clinic, individual clinic. Sometimes they give a cut of 5 to 10% to 25%. So for example, for the first 2,000 riyals, you will be getting a 5% perk. And for the next 1,000 riyals, you will be getting 10%. If you are making more than 4,000 riyals, 5,000 riyals, you will be getting 20%. So you get a good considerable salary. So for around 1,500 to 2,000 you can make in a normal clinic, which is translating to somewhere around 3 to 4 lakhs.
It's a pretty decent pay for a BDS, and I just want to know the work scopes, sir. Like, what are the work we are allowed to do? What are the work we need special privileges, like implants can we place, root canals are we allowed to do, smile designing, cosmetic dentistry, because a lot of people are studying these kind of small courses. I just want to know, as a BDS, if I am coming today, this 2022, your times and my times are different. We have finished college before 20 years. I really want to help the youngsters to know, if they are not able to do MDS, with plain BDS, with what are the courses really in need in Muscat? Like, if they come to Muscat with this certification, like for a smile designing, veneers, bleaching, anything, what are the clinical subjects they are looking for?
So one of the most important requirement, as a private practitioner, the money is more in implants. So having an implant as an additional qualification is very good. But the ministry has their own set of ways to approve your certificate and all those things. So they ask for certain working hours. So they have certain institutions which they recognize, and they have some criteria to fulfill. So these things, and also you may have an exam or interview, whatever. So you have to fulfill these criteria to get the license to practice that. But as
so you're talking about the license of a particular subject, like implants, you have to have a special license?
Yeah, but you need to have an approval. For example, you basically this is given to is done by either periodontist or the oral surgeons there. Okay, those are in the specialist category. But for a BDS general dentistry to do this, I think they have exempted certain certificates or certain courses. So you need to have certain hours of practice, certain number of implants done, and all this. Based on that, they will interview you, and then they give you a license to do this, because you are not otherwise allowed to do.
Okay. So we need a special privilege license for particular subjects.
Yes, particular subject.
What about basic stuff like veneers and prosthetic dentistry, like restorative dentistry?
Restorative dentistry, there is no problem, sir. I can do anything. But even prosthetics, I don't think there should be much of an issue with that. But when it comes to veneers and all those things, I'm not very sure of the recent guidelines, because these guidelines are changing. very often. So I have no idea about what are the present guidelines for the veneers and all those things. But I think general dentists should not have a problem doing veneers. So, but implant is a surgical procedure. So veneers are not considered to be a surgical procedure. So possibly that is one of the reasons that you don't need any approval for that. But I think a course would be good for them to be foolproof, because they are very demanding. You just cannot just do a veneer and just get off with that, because the patients are going to come back to you, for the follow-up and other things. So I think it's better to have certain amount of knowledge and sufficient training in the subject before you venture into it.
Sir, in MDS, there are a lot of people who have completed. So please tell me, in MDS, which is the subject most wanted, first, second, third, what you will tell first?
Like everywhere, orthodontics.
Hey, orthodontist friends, please
one.
note down, ortho is told ortho. So please pack up your bags and go to Muscat. Orthodontist.
Everybody is conscious of looks and other things, orthodontics.
Okay.
And what I noticed there is, there are not much of I don't know, in my area there is only one periodontist. So periodontia also have a good scope, but it's an expensive affair, for a very small problem. Or so it is believed. So you have to establish, you need to work a little harder than...
What about other subjects, sir?
Other subjects, maxillofacial surgery, you cannot practice in private because you need a proper OT setup and all those things. So mostly ministry has the maxillofacial surgeons.
So for maxillofacial surgeons, ministry, if there is a vacancy, if they apply, they get.
Yes.
Okay.
And endodontics. Endodontics is the next favorite, I would say, because RCT is one of the most sought out, and there are no specialists in the ministry except for the Muscat. In our region and all, we don't have an endodontist.
So there is a good scope, dear endodontist friends. What he is telling is, in the headquarters, which is like the country head capital, Muscat, has got endodontist. Whereas in other places like Salala and few other places in Muscat, where there are ministry, government of Muscat has got hospitals without any endodontist. So if you apply for it, there are high chances of every endodontist to get a job there. So please try over there, right, sir?
Yeah.
What about other subjects, sir, like pediatric dentistry?
Pediatrics is good, actually. Not only the problem is the awareness. They don't think that pediatrics should have a separate doctor. So that awareness is less. Now only we are trying to get that awareness of a pediatric dental surgeon there. So
presently,
pediatric dentistry is good.
Presently, in a clinical scenario, suppose in your clinic, if a patient comes, say 4 years child with lot of caries, how do you manage?
In the ministry setup, we generally go by the rule, by very badly decayed tooth extraction, and then restoration, and in fact we end up doing the pulpectomy and all those things. And but most of the time, what happens, the pediatric cases are way too high, and the children are very uncooperative for this thing. But then in a very bad mouth, we in fact even go for extraction under GA.
Oh, okay.
So many, more than 8 teeth, we go for extraction under GA. Because the child is cooperative, medically compromised cases, we do these cases, we admit these cases, and then we extract the teeth. But now that there is a pediatric dental surgeon available there in Salala, we are trying to rehabilitate all these cases. So we refer to the pediatric dentist. But it's expensive, and finally the parents' question, why for a deciduous tooth it's going to fall anyway. So that kind of a stigma is still there. So the importance of the pediatric dentist is still not very well established.
As digital technology is picking up in a big way in dentistry, like intraoral scanning, milling labs, making templates, guides for implantology and other related subjects in dentistry, what is the present scenario there? How good is the country as such?
The technology is there, sir, but not very prevalent. Like for example, very specialized clinics, very few clinics have all these technologies, especially in capital. In our area, I think 1 or 2 clinics, very few clinics have that. But still there is no intraoral scanners and all those things still not available. And even the labs, very few labs are there, and there are some real good labs. Otherwise, they usually send it to other countries to get the job
When
done.
you make a crown like zirconia crowns and things like that, Does it look good? Like here in India, we have fantastic labs.
Yes. You know, even there they have a good lab. You know, there's a lab called Gani in Muscat. They're doing good job.
They're from Chennai, right? Gani lab, that lab.
Is that I didn't know about?
Gani was there before.
Okay.
I think he was an ex-dental technician from army.
Possibly.
One little old man.
Possibly.
Oh, great. Gani lab is there.
Gani lab is there.
So he's doing a good job.
Yes.
Wonderful. Dental technicians, if you're watching this, you have a good scope, and they can come and set up a lab there, sir. If any dental technician wants to set it up.
This is what I said. No, I said that the ministry keeps changing a lot of recommendation rules and these things. The guidelines.
But there is some scope.
Yeah, there is
people
scope.
who are certified from European countries.
There is scope. See, the thing is, there are a lot of dental clinics and the labs are relatively less.
Oh, okay.
So you have a scope.
Business opportunity.
You have a scope, of course. You know, but depends on how you establish. But then I think for everything you need a local sponsor.
Achha.
And there are a lot of. And another thing is there are a lot of Omanis who have done the technician courses. So there are locals available.
They know where to make the money.
Yes.
Dear dentist, it's so good to interact with the person who's really coming from that particular situation. So in this, Dr. Ernest has really given us great real ground inputs which we cannot get from anywhere other than the person who's coming really from there. Sir, we are very thankful to you on behalf of Malligai Dental Academy that you have given us a valuable insight, especially for the youngsters who are watching this and who wants to go and work there. Thank you very much for your lovely input. We wish you all the best, sir, and I wish all the best for the viewers who are trying for this. If you have any doubts, please pass your questions in the comments column so that I can pass the questions to sir and get any clarifications about the same. And if you are not subscribed, please subscribe to our channel. Regular useful videos we are putting in our academy channel, especially for dentists, dental technician, and full dental ecosystem is getting benefited. Thank you very much, sir.
Thank you.
Wish you all the best. Thank you and God bless you. Thank you, dear viewers. Thank you so much.